Dr. Menen, as someone with deep clinical expertise within our healthcare system, can you share within your own personal experience around how you can see a virtual expert second opinion improving outcomes and connecting that member to care? Do you have any member examples maybe that you could share with this group?
Absolutely. You know, I have a fantastic example of how this connection occurs. I was involved with a colleague's daughter who got ill, and I think that parents, all of us who are parents, can just imagine what it feels like. We have a daughter who's perfectly healthy, and then she shows up one day and says, you know, I'm having fevers and unexplained shortness of breath, and my heart is pounding, and I'm weak, and I can't function. And that just hits us all in our hearts. And so in this colleague's case, she took her to a world-class healthcare center. And so, you know, having all of the expertise and capabilities that you might imagine would be associated with that, but the complexity of her situation and the vague nature of her symptoms made it more difficult. So 2nd.MD was brought in, and I think, to me, this is just sort of the dream team. This is what medical care can be at its best. They brought together a group of experts from around the United States, each experts in their various fields, neurologic, rheumatologic, cardiology, and they were on the phone at the same time, collaborating, thinking about what could this be, what's the best course of action, how could we best get to the bottom of what's causing this problem. And I personally have never been part of a discussion with such far-reaching implications with a group of people that was so expertise. So I don't consider this just simply a second opinion, but rather a way to guide, diagnose, offer opportunity, expert ideas in a synchronous way, live, face-to-face, with a group of experts forefront and together collaborating on developing the best possible care. It was a fantastic example of the power of this kind of communication and collaboration.